This June is Men's Health Month. It's a time to encourage men of all ages to think about their health and take the necessary actions to take care of themselves. Nationwide, 61% of people waiting for a life-saving transplant are men. And when we look at the Texas State Registry, 44% of men are registered organ donors compared to 56% of women. Joining us on TOSA Talks this week is double heart transplant recipient Lemuel Bradshaw, who knows just how important it is to make health a top priority. And Lem, throughout the years, you've had your ups and downs with your health that have required you to have a heart transplant to survive. Can you tell us more and describe your journey that led you to receiving the gift of life?
I had what's called viral cardiomyopathy, or an enlarged heart caused by a virus. And as near as they can tell, it was the bronchitis that was the cause. Something that a lot of people have had, something that I certainly didn't think was going to slow me down. I was 28 years old. I had never really been seriously ill with anything before, chicken pox and strep throat all my life, most serious things I'd ever dealt with. This bronchitis was cured with a 2-week round of antibiotics, and I went back to living life the way that I thought I always would. We had recently, my wife and I got married into 3 daughters, 8, 9, and 15 years old. And who has time to be sick when you're raising kids? About a year after that, I finally got sick enough to where I couldn't leave the hospital. And with 48 hours left to live, a family of heroes made a decision on a night when they lost their father, their husband, in an auto accident, and almost lost one of the 2 daughters, that they wanted to donate his organs. It was a conversation they had had even before the night of the accident, thankfully. And because they did, I got to see 3 daughters grown and gone are the best kind of kids you can have. And they brought back 9 grandchildren, the best things that your kids can bring back to you. I was diagnosed again with a problem this time that resulted from all of the years of medications that had kept me alive after my transplant. Immunosuppressant drugs and others. They save your life, but they're hard drugs. And after a while, my heart developed issues that led me to be listed again. And once I was listed, it was 4 years before they found a suitable match this time. First time within 48 hours, a match was found from the time that I was put in the hospital for good. This time, 4 years went by. And when I finally got that heart, it was, now almost 3 months ago. Let's see, February of this year, a little over 3 months. And here I am now, back almost 100%.
We're so glad to hear you're doing so well. And you were talking about how your immune system is suppressed. So you have to be extra careful, especially with this pandemic. What do you do to make sure that you are staying safe and healthy?
I am, of course, almost insane about hand washing. Social distancing is everything. I have to make sure of whomever it is that comes to visit, make sure that they've quarantined the way that I have, which means that you probably don't see that many folks. I see most of them through the lens of my computer, the screen of my computer. So it's been an exercise in being careful.
Talk about what you've done to maintain a healthy lifestyle all of these years with your first transplant and now your second transplant.
Diet, exercise, adherence to my medicine regimen, and just general cleanliness. I was told that one of the things that one of the transplant drugs does to men is it reduces the muscle in your legs. And I was determined not to have that happen to me. So I started an exercise routine that included lifting weights. I have an example to set, I think, for our younger brothers and sisters in transplantation. There are a lot of people who look at me and say, for whatever reason, you inspire me. And I feel that if that's the case, maybe I could do a little something to get them out of bed and to get them on the road or into the gym whenever we go back, or at least, doing something around the house.
Not only are you a transplant recipient, but you also work very closely with the donation community at United Tissue Resources. And as you know, unfortunately, not everyone is in the best of health. How would you encourage other men to make sure that they are living a healthy lifestyle?
I think it is important for all of us to consider that it is not just avoiding a heart transplant that is the reason that we should get out and do something healthy for our heart, for our general well-being. There are a number of reasons beyond just avoiding my experience. because my experience is unique. You may not have to have a heart transplant to still be sick. A lot of what makes us sick, we could avoid, we could prevent if we only put a little effort into it.
Get out there, stay active, and be healthy. Get a checkup if you have to at the doctor. Thank you, Lem, for taking the time today to talk about your transplant journey and also bringing awareness to Men's Health Month. And if you enjoyed this episode of TOSA Talks, we hope you tune in next time. Until then, you can learn more about organ donation and how to sign up to save lives at tosa1.org.